Namaste, ma'am.
Namaste. Good afternoon.
Good afternoon.
How was your Rath Yatra, Shilpa?
Oh, it was wonderful, ma'am. Just came yesterday afternoon.
Nice.
It was wonderful. Yeah. Thank you.
How's your stay going, Nisha?
Good, good.
Bangalore weather's treating you different?
Yeah, it's nice. It's nice. It's cold. It's cold and like pleasant cold. It's not like very cold, but it is pleasant.
Nisha's in Bangalore, everybody. She's been taking classes from here.
So we'll continue today. Dr. Renuka, due to some emergency, she is not coming. She'll take the class on Wednesday. So I will continue with postpartum physiology, lactation, and postpartum depression. And then tomorrow you have a class with nutritionist, and you will second half you will have a postpartum demo. So whatever class we have on Wednesday, we are preponing them, and Wednesday you will have a class with Dr. Renuka. Okay. So we'll be beginning with the postpartum physiology. So before I begin, have everybody seen the movies that I had shared?
It's the first one, the birthing video.
Yeah, even I've seen the first one.
How was the first movie?
In my opinion, because it's an abroad video, I feel there are a few unnecessary details. They go so much into this, style part of just the body and just some unnecessary elements. But the talking of the one who actually spoke during the other things when she was scientifically talking, that was very nice. And then it coincided with whatever you were saying as well. It was familiar. But otherwise, they bring in a lot of extra elements also. It was a bit funny.
Yeah, just to make it more. For more common people, like they would like to watch it. Otherwise,
my daughter was saying this. See, she's walking here. Their stomach is seen and all that. It was a bit different.
So, who all watched the movie?
Sorry, I'm writing in the chat box.
Okay. So, who watched the second movie? How was the second movie, Snehita?
I am not a mother, but it was a little scary to watch. Like, okay, this is the pain that they go through. everybody feels it is like a family event, but today they are making it as an commercial thing. So that's it's a little bit.
You will see a huge difference between the home birth
Mm.
and the
Yes,
what
yes.
birth that happens in the hospitals.
Mm.
So just watch that movie that is going to show you, like you may have now understood how the water birthing is happening, how one lady was delivering on a toilet seat. You will
Yeah.
see different ways how one woman who had delivered on the knees, kneeling. So you'll get a better idea about all the labor positions that we have discussed. So you have to watch the second movie. It will give you the idea like how now naturally also in all natural circumstances you can deliver without a lot of noise, without a lot of things around. So do watch that movie, and it will take you a lot of your fears also, that unnecessarily you will not see women screaming like crazy. There is a pain, but yes, without as we have discussed, without noise, without sound, there is no creation that would take place. So there is some sound, there is some that pain is seen in the documentaries also, but they are better able to manage their pain. And you will see different ways how they are managing the pain. Sometimes a partner is supporting, sometimes partner is massaging. So you'll see how a partner support is also essential when it comes to delivery. So you have to watch that movie. It will help you practically understand. So that movie is also mandatory for you to watch. So do watch again. It's a short movie. It is like 45 minutes or maximum 50 minutes movie. It's not as long as the first movie. Okay. Okay. So we're going to move to the postpartum part. So we had discussed different types of labor. So I'm just going to write down the different techniques a woman may choose to deliver a baby. One is normal birth without any medical interventions. Okay. Then you have normal birth, like vaginal birth, but with like medications, like you are inducing the labor and then you're going, so you are taking certain injections to progress into the labor. Then you have normal birth or vaginal birth with some kind of interventions like instruments like forceps or vacuum. Okay. So you have like three categories of medications or also some medical interventions like episiotomy.
Disha,
Yes.
just a quick question. In the schedule, it is written the Ayurveda
No,
class.
we already discussed. The doctor is not available today, so we are discussing this.
Okay. I'm sorry. Actually, I got internet issue, so I missed that part. That's
No
why I asked.
problem. No problem.
Okay. Thank you.
C-section. We have C-section that is like planned C-section. So planned C-section, in some complications, you have planned C-sections where you are not waiting for the labor to start and you are just your C-section date is scheduled and you progress into the C-section. Okay. Then you have emergency C-section. Okay, so these are like some of the ways a woman may have gone through a delivery. Okay, so this 5 categories clear. Like you choose normal birth without any interventions. Like whoever has watched the movie, they know that a home birth without any medical interventions. In some hospitals also, they may not interfere with anything. But nowadays there is a protocol to know, even the labor has started to progress into the labor they induce. They give the oxytocin injections to make the contractions more stronger and progress faster. Sometimes there is a protocol of episiotomy, like they do not want to be longer in the transition phase. So if the woman is 7-8 centimeter dilated, they would immediately put a cut and they will get into the pushing stage. So that do not want to wait, though the transition phase is the shortest phase, but it is also the most intense phase. So doctors may do not want the patient to go through that kind of a transition intense phase of contractions. Then they do episiotomy. There are many blind protocols that are doctor following these days, and like I said, after the baby's delivery, they may again give an injection immediately to deliver the placenta. So within 5 minutes, the placenta can be delivered. So just to hurry on to the process, because they do not want to spend hours together on one patient. They want to have many more deliveries happen or many more patients to check. So are taking some blind protocol. So you have to understand that choosing a right doctor is going to solve half of your problems. Okay. Otherwise, even sometimes you ask some questions, it may go on to their ego and they get offended. Okay, that why you're doing a cut, why you're doing episiotomy, why you're not waiting for the complete 10 centimeter dilation, why you are inducing, why we are not just progressing naturally into the labor. So you have all the rights to ask, but most of the time women are also so much scared about the process of labor. Then whatever doctor is saying, they will just say, okay, whatever medications we are supposed to take, we'll take it. Epidural is also one of the medications that women are taking to avoid pain. But the problem with epidural is if you do not feel the pain of your contractions, you will not understand the intensity of the contraction, and your pushing is not going to be that efficient. Okay, your pushing is more of a robotic, like a doctor is checking the contraction on the screen, the intensity of the contraction on the screen, and telling a woman to push. But how to push, where to push, unless and until you feel the pain, you will not be able to push it more efficiently. Okay, so because they are too scared of the pain, they say that, okay, doctors say, okay, you're very scared of the pain, let's do epidural. So they paralyze the part, but the epidural dosage also has to be monitored. Otherwise, it can also, for temporary or long term, it can damage certain nerves, or it can create a back pain for a long period of time, or it could be short term, it could be long term. But postpartum back pain is much common than the pregnancy back pain, because pregnancy, your baby was not that heavy, and postpartum you are going to lift your baby that is heavier, and your abdominal muscles are also weak after a delivery because they are loose. They're not going to become tight overnight. They're loose because they had stretched so far, so they're loose, they cannot hold the back muscles in the place. So postpartum back pain is much more common than pregnancy. Yes, in pregnancy also women may experience back pain in the third trimester, especially towards the end of the delivery. But postpartum back pain is much common, and many women also get into the next stage of back pain, like they may have herniation, they may have slip disc if they are not toning their muscles, they are not doing any exercise to tone their abdominal and back muscles. Okay, so that can progress to other conditions. Like I know a couple of people who had developed a disc herniation postpartum, slip disc postpartum, because there is no proper care taken like to heal and tone these muscles, and you're going to lift your baby all the times, and there is a pregnancy induced arch that is created in your lumbar that you are also not correcting, so that leads to more back pain. And while you lift, most of the time that arch is going to be created when you're lifting your baby up. So these are some ways a woman choose to deliver, and depending on how the delivery is done, the postpartum recovery will take time. Okay, so if there was a normal birth without any medical interventions, then the recovery, and if there is no perineal tear or just a first degree or maximum second degree of perineal tear. Now, what is this perineal tear? Can you tell me? What is a perineal tear?
I don't know the right medical term, but doctors used to cut the part from where the baby is coming out towards the anus.
So that is a space between your vagina and the anus. Okay. So when you want to say you want to make a root lock, so you say that contract your perineal muscles. Okay, so these are your perineal muscles, and first, second, third, fourth degree, they are the progression. First degree is more of a skin. Okay, where there is a tear onto your skin, the outer layer of your perineal tissue. Second degree is underneath the skin. There is a connective tissue that is underneath your skin that is being torn. Now the third degree is the muscle. The perineal muscle is actually being torn. Then the fourth degree is even the deeper tissue is being torn. So unless and until you put a cut, third, fourth degree tear is usually can be avoided. If you put a cut, if there is an episiotomy done, then it leads to third, fourth degree tear. If there is no episiotomy and you are mentally calm, then you may have first degree tear or maximum second degree tear, or you can completely avoid the tear also. So it depends on how mentally calm you are, because the more you stay mentally calm, the muscles will relax. You stay fearful, you stay tense, you stay stressed, then your muscles are going to contract, and that leads to perineal tear while you're pushing. Okay, so the amount of force you're going to apply, and if you're not relaxing yourself mentally and physically, then the muscles will not open up, and it leads to tear because the baby has to come out. So that is to avoid any kind of perineal tear. First of all, you need to be physically and mentally calm. Okay, so the more you stay mentally calm, the more you focus on your breathing, there are less chances of the tears. Even if you have the tear, it will be first degree tear. Okay, so try to avoid that. So if there is no medical intervention, no episiotomy, then there is a chance that a woman may have perineal tear, may not have, but it wouldn't be more than second degree tear. Okay, so depending on the number of degrees tear you have, the recovery will take time. If there is no perineal tear, within 3-4 days, the pain in the vagina would go away. If there is a first degree tear or second degree tear, it may take 7 to 15 days for the pain to go away. Okay? Nowadays, doctors are giving painkillers so they do not feel a lot of pain. They might feel just discomfort while walking and going to the toilet. So that is because you are taking painkillers. If you're not taking painkillers, that is when you will actually understand that whether you have the pain or not. So understand, if there is a first or second degree tear, it may take up to 10 to 15 days for complete healing. It may, and first degree tear do not require stitches. Second, third, fourth degree may require the stitches. Okay, so you need to understand if there are stitches taken for the perineal tears, it will take a little longer to heal. If there are no stitches taken, then it will heal faster within a week's time. Okay, so after 1 week's time, once the pain has gone, you may start with gentle movement, slowly, slowly, slowly. Okay, but if there is a perineal tear and it has the stitches, so in some so here you may have taken medications, episiotomy may have done, and whenever the instruments are being used, whenever you're using the instruments as forceps or vacuum, episiotomy has to be done to insert the instrument. Okay, so there will be stitches in this cases. So recovery is so slower when you have stitches. Then the second case where episiotomy is done just to bring the baby out, or you're using vacuum or you're using forceps, in such conditions there will be stitches. So there can be, it may take 4 to 5 weeks for the stitches to heal. So for a safer side, you will wait up to 6 weeks. On a safer side, you will wait for 6 weeks to begin with some asana practice. Before that, you may do joint movements, you may do gentle movements, very gentle movement, but no movements or pressure should be coming onto your vagina. Okay? If there is any discomfort, you may use a donut cushion. Okay, if there are no stitches, you may start after 2 to 3 weeks with gentle asana. And you can start with strengthening of the pelvic muscles. Okay, here you will wait up to 6 weeks, and then slowly after that you will start with gentle asanas and will focus on pelvic strengthening. Hip opening practices should be avoided in normal case of delivery. You will wait for hip opening practices till 10 to 12 weeks. Whatever the case may be, whether it's a normal birth without perineal tears or first degree tear, or any interventions and the stitches had been done, you will wait for 12 weeks to do wide-legged hip opening poses. Okay, active and passive both. Till that time, you will be 4 weeks to 12 weeks, you will be gentle. You will be performing all gentle asanas, and prone poses are one of the wonderful practices for people who have delivered normally. So you can focus on those baby cobra poses, okay, like Salvasana or Superman variation of Salvasana. So those gentle variations you can focus on. It is going to help tone your abdominal muscles, tone your lower back muscles, and also help tone pelvic muscles. Okay, and Setu Bandhasana is one of the posture that is very, very important for postpartum, whether it's a normal delivery or C-section. In both cases, Setu Bandhasana is one of the wonderful posture to strengthen your pelvic muscles, abdominal muscles, and lower back muscles. But we will talk about the another changes. Let's just complete the delivery timeline when you can begin the practices. And Now, in case of planned C-section, you would not have labor started. So there is no changes that has happened into your pelvis. Okay. So there was no cervix dilation. There was no pressure that was created on the pelvis. So your pelvis was as it is. Okay. No changes. There might be a shortening of the pelvis, but it doesn't lead to that kind of a physiological changes that it usually happens in a normal birth. So in planned C-section, there is no discomfort in the vaginal area. Okay, so to sit down and all these things will not be uncomfortable. But when you have C-section, you are also asked not to lift your baby for a few weeks. Okay, and the C-section takes a little longer to heal because there is not just abdominal stitch that is taken. Okay, there is a cut on your abdominal muscles, then there is a cut on the connective tissue that is there inside of your abdominal muscles. There is a cut on the your uterus. Okay, so the uterus stitches are the one that take the longest to heal. Okay, so it usually many times, especially with C-section, they are so scared of postpartum weight gain. Okay, and they are like because their belly is a little bit more, it is going to be more bulgy than women who deliver normally postpartum. So postpartum, if a woman has delivered normally, their belly will heal faster. Okay, compared to women who deliver with C-section, their belly size will continue to be little bloated or little larger than women who would deliver normally in postpartum phase. So the recovery of the uterus is comparatively slower when it comes to C-section. So the belly looks flabby, bloated, soft, bulgy. Okay, these are all common, and for that reason, sometimes women think, they start doing. Yesterday only, I got a call from one of the old students, and he was asking me that her student had delivered with C-section, and after 6 weeks itself, she had started crunches and all. So I cannot say. See, everybody's recovery rate is different, but to be on the safer side, we do not recommend doing any practices, core strengthening practices, or any other practices on the belly up to 3 months. We should start only after 3 months because it takes at least around 12 to 14 weeks for the stitches to totally heal. Otherwise, it can lead to you don't know whether your uterus, if there are stitches torn or something, internal bleeding starts. Okay, it can lead to sometimes if the connective tissues, the stitches are taken on the connective tissues, and then you start doing crunches, and if they have just healed, okay, if the tissues have just healed and you start doing some like you start going into the advanced back bend or you start doing a lot of crunches, then the tear may again happen, and it can also increase the risk of hernia in the future. Okay, so forget about just abdominal separation. That may be because you start doing mindless practices after your C-section. Okay, so after C-section, there are higher risk of developing abdominal separation or some kind of issues internally. To avoid that, you will avoid all the, like, even you will start Makrasana after 10 weeks. Okay, you can start with your prone poses, resting in Makrasana around 10-11 weeks, and gradually after around 11 weeks, 12 weeks, you can start with easy Cobra, Saral Bhujangasana on your forearms, and then slowly you can start taking more and more prone poses, and you will be very gentle with your back bends. You will be going gently into your core exercises. You strengthen your core muscles and back muscles. Okay, so just give yourself some time to heal and don't get obsessed when it is a you will avoid any hip opening postures that also needs a lot of core engagement, like all your warrior poses or kali asana poses actually also have a lot of engagement on your belly also. So you would avoid those poses up to 3 months, even if you have had a C-section planned where there is no lot of discomfort in the vagina. Okay, so you will avoid hip opening that put a lot of pressure on the core. You may do gentle hip opening, seated hip opening postures in planned C-section. It wouldn't be a problem. Okay, but always remember, C-section, whether it's planned or emergency, they can go back to their advanced practice only after 5 or 6 months, depending on the recovery. So if you are an Ashtanga practitioner or if you are an advanced back bend practitioner, whatever advanced poses you're doing, you can gradually build your practice from 3 months onwards, slowly taking yourself, and after 5 months or 6 months you are ready to do all your advanced poses. So always when it comes to postpartum practices, you're always going to progress as a beginner, no matter how advanced practitioner you are, whether it's a normal delivery or a C-section, you will progress uh, as a beginner. In case of normal delivery, you are ready to take on to your advanced practices after 12 weeks. In case of C-section, you are ready to take on to your advanced practices after 5th or 6th month. For normal people, we would want to wait for 6 months because they may have never done the advanced practices. As an advanced practitioner, you might even be ready to do your advanced practices from 5th month, 5th and half month. So it all depends on how long you have been practicing before your pregnancy. Okay. In case of emergency C-section is what? You were into normal labor, but something happened, like all of a sudden baby's heart rate dropped, or all of a sudden during labor, doctor found out that you have lost all the amniotic fluid, and baby has pooped, or there is like a cord that is tangled 2 or 3 times, and it is suffocating the baby. Baby is put under stress, baby's heart rate is increased. And such emergency complications where you go, where you're already into the labor, already your cervix has dilated 5-6 centimeter, some dilation has happened at your cervix, but at last minute you are supposed to go for C-section. In that case, you will be careful with your hip opening practices also. So hip opening practices, advanced hip opening practices are not recommended up to 3 months. Okay, so you will understand this women will also have discomfort in their vagina, pain in the vagina. At the same time, they have stitches on their belly and the uterus. Okay, is that clear?
So Nisha, in case
Yes.
of emergency C-section also, the guidelines will be same as planned C-section, right?
Guidelines same, but in plant C-section, you may do Upvishta Konasana also after 8-9 weeks or after 5 weeks, 6 weeks when you want to do, because Upvishta Konasana is a passive, or you may also do a split. Okay, if you're an advanced practitioner, so you can do advanced hip opening in plant C-section, but you will avoid that in emergency C-section because there is again vaginal discomfort. We do not want to go with any hip opening until we complete 3 months. You may do light hip opening poses like Badkonasana, okay, but we do not want to go into practices like Mandukasana, Upvishtakonasana, or active poses also.
Okay. And I have one more doubt. So there are two things: normal vaginal birth with medication episiotomy. So what is episiotomy?
Episiotomy is the cut you put. As I
Okay.
said, you put in the
Right.
from the vagina to the anus, there is a space, you have a cut there
Okay.
to
So what
have
is
a
the
bigger
difference?
opening.
What is the difference between this one case and the other with instruments? Because in episiotomy also we are using the instruments, right?
That's what I said. Whenever you have stitches, the protocol is the same. That's why I mentioned the protocol between second and third header.
Okay. Okay. And whenever we are having a cut, whether it's second degree, third degree, or fourth degree, in all the three cases,
Even if there is no intervention, I just said there are this ways you may have delivered. If there are stitches, the healing is slower.
right. So what my question is, for second, third, and fourth degree in three cases,
There might be stitch for third and fourth degree, for sure there will be stitches. Second degree tear, sometimes there is a stitch, there is not a stitch. So you just have to see if there are any stitches. The recovery will be slower.
So if there are stitches, what my question is, then the healing time is 4 to 5 weeks.
Yes. Safer side, you wait till 6 weeks.
Okay. Okay.
Okay, because these are external stitches, not like your uterus. There is a stitch into your organ that takes at least 1 to 2 months for internal stitches to heal.
Okay. And whenever doctor use vacuum as an instrument, then also the stitch will be there.
Yes, because they have to cut to insert. Okay, they will put a cut to insert the vacuum or forceps. So there will be stitches. Whenever there is any kind of a cut, there will be a stitch. And when you do episiotomy, they put a cut and there is a high chance of third and fourth degree tear with the episiotomy. That's why they will have more stitches.
Right.
Okay. And sometimes they do husband stitch also. When they're stitching the episiotomy stitch, okay, wherever they have put the cut, just to ensure they do not have sex during this time, they have because they may have experience in some cases where after stitches because they are taking painkiller or something like that, they after within a few days itself they get into the sexual life. So they even again tear that stitch or affect those stitches. So sometimes they call that stitch as a husband stitch. That is not supposed to be taken. Okay. If you take that stitch, after that, your sexual intercourse will be very, very painful. Because wherever you take stitch, that tissue becomes tight. And that's why we do not want to go into the hip opening practices immediately. We want to progress slowly and steadily, taking one posture at a time, just as we do with beginners. We do not take beginners into the Hanuman asana or the splits immediately. We do a lot of preparation. Just like that, we will focus there. So wherever you have stitches, so in your perineal muscles, you have the stitch. That means those muscles are going to be tight. So if you do, like if you get yourself into the immediately hip opening postures, it may lead to tearing. So initially, we want to focus on strengthening part and gentle opening like Baddha-Konasana. You may start with Baddha-Konasana. Okay, you may do Virasana, whatever you feel comfortable, you can do those poses. And in case of C-section, again, understand the stitches make the tissues become tight. And if you go into any overstretching of your belly muscles or over contracting of your belly muscles, in both cases, it can lead to some kind of tears. Okay,
Right.
so it can affect your healing. It can create other problems. Like my cousin, she had some fat removal surgery. Okay, and then her skin had become too loose. To tighten that skin, the doctor had to take out again like 5-6 kilos something and did the stitches. She had a lot of stitches on her abdominal muscles, and 3 times her stitches were torn. She was just resting. And then doctor said, your skin is very thin. That's why the stitches are getting torn. And now only the 4th time stitches stayed and healed. Stitches were removed. But still, she has not gone back to Australia because she doesn't want to take risks. She has extended her period. So understand these things can be very critical, and I just don't know why people like to take risk with their own body by just getting obsessed about something. Here, most of the cases I know that they are so they get so conscious about their postpartum weight and the way they look. They want to hurry into the exercise. They want to lose weight overnight. They never control their diet during pregnancy. They thought that whatever I will eat, it is magically going to disappear after the baby is out. And then they have eaten excessively. They have fulfilled all their negative cravings, false cravings, and they've eaten all the carbs and fats, and then they think that postpartum baby is out, so my weight also should go out. It is not going to happen. And then once the baby is out, they cannot accept the way they are looking, and then they want overnight weight loss. It is not going to work. Okay, so being mindful during your pregnancy, you will of course not have extra weight, and within few weeks itself, within 3 to 4 weeks, you will feel normal before your pre-pregnancy stage. Okay, so always be mindful. You're not supposed to eat for 2 during your pregnancy. That is what we are brainwashed by our parents, because they are over pampering us. You have to eat for 2, you have to eat for 2. But know that 2 is very small until 6-7 months. Only from 7 months actual weight gain is happening in the baby. That time only your appetite is going to go a little higher. Okay, so you should not be eating mindlessly. Eat only when you are hungry, and always remember to keep your stomach 1/3 empty while you're eating. Never eating full stomach will help you understand your appetite, chew your food properly. Chewing will also help your body to understand if you're full or not. Okay, so this is with all the types of delivery, and the way you deliver, the recovery process will vary from whether you have stitches, whether you do not have stitches, whether it was planned C-section, whether it was a emergency C-section. So you need to just understand normal delivery without stitches, with stitches. Okay, then C-section, planned C-section or emergency C-section. Okay, so if you just understand these 4 categories, you will know how much approximate that body need to recover, and then you're going to gradually build. So I have a homework for you. You must do this homework. You're going to go through the manual that I've given, the protocols for the postpartum. Okay, and all the postpartum protocols, this is just for your understanding what all asanas, how you can start, what all things you can add with. Okay, so you're going to go through it, and then whenever you have questions, you're going to ask me. Okay, so let's understand some more physiological changes in the postpartum phase. Any questions with these 4 categories we have discussed?
Ma'am, by protocol, like the homework you have given is about like what we can do after 6 weeks or in case of C-section or not C-section, right?
Yes, in your manual, the main practices that are given is for the normal birth with maybe stitches and not stitches. So you just go through that, and C-section, you will be able to start some immediately, and some poses you will be starting only after 10 to 12 weeks. Okay, like all your prone poses, you're going to start in case of C-section after 11 to 12 weeks. Okay, so just go through it within first 2 days of your delivery, what practices you can do. Okay, and then first there is a First term is the first 3 months after your delivery. Second term is 4 to 6 months. The third term is 7 to 9 months. So like that, I've given, there is an active protocol, passive protocol. So what is an active protocol? Active protocol is when you do not have bleeding. So one of the changes, postpartum change, is you will have postpartum bleeding for up to 6 weeks. And this bleeding would change in color as you will progress into the postpartum phase. Initially, it will be red, maroon color. Okay, then slowly it is going to become yellowish and it will progress to becoming white, kind of a discharge. Okay, so up to 6 weeks, you will have some discharge changing in colors from red, maroon to yellowish and becoming white. Okay, and normal physiologically till the time you breastfeed, you would not have menstruation. So breastfeeding can work as a contraceptive. So till the time you breastfeed, like you're breastfeeding for 6 to 8 months or 1 year, you might not have your menstruation. That is theoretically. But practically, there is also possible that after 4 or 5 months of breastfeeding, you may start having your ovulation. So that is normal because that is also 4 to 6 months exclusive breastfeeding is needed for the baby. After that, your body is also preparing in such a way that you get into your normal cycle and your baby also start eating the food. Okay, because now baby is growing bigger, baby's demands are going to be increased. So only on the breastfeeding, it will be difficult for your baby to continue to grow. Okay, so exclusive breastfeeding is recommended period is 6 months, minimum 4 months, but it is recommended you breastfeed exclusively for 6 months. After that, it is mother's and baby's choice. So till the time you breastfeed, you may not have your menstruation. So when you do not have menstruation, that phase we consider active phase, where you can do your inversion practices, core exercises. Okay. And when you have your menstruation or when you are having your postpartum bleeding, that will be a passive phase, where you are going to avoid all the inversion practices and core exercises.
Ma'am, what is the reason like when we are breastfeeding, there is no menstruation?
Yes, because your prolactin suppresses FSH and LH. When your prolactin goes higher, it is going to suppress the FSH and LH. And FSH and LH suppress, that means no ovulation will take place. No stimulation of follicle, no ovulation. So you have two breastfeeding hormones. One is prolactin, that is needed for the milk production. And there is another one is oxytocin. Oxytocin is the one which helps letting the milk out from the breast. Okay, so it does the contraction. So it is very important for you, if you want your body, your belly, your uterus to heal faster and reduce bleeding, you start breastfeeding immediately, because the moment you start breastfeeding, the oxytocin levels are again going to increase. During your labor, oxytocin levels were high. Now, if the moment you start breastfeeding, your baby would be ready to nurse within 20 to 30 minutes after delivery. So the moment the baby is ready to nurse, you should breastfeed. And the moment you breastfeed, oxytocin levels will further rise. The moment oxytocin levels would further rise, the contraction will happen in the mammary glands of the breast to let the milk out, and side effect will be uterine contraction. This contraction will help postpartum the risk, it will help reduce the risk of postpartum hemorrhage, like excess blood loss that happens usually after postpartum. Okay, so it will also help reduce the bleeding, and the more the uterus will contract, the faster it will come back to the normal size and shape. Okay, so the breastfeeding is one of the very, very important tool for your uterus to heal faster. And in case of C-section, especially in case of planned C-section, there is no high level of oxytocin. That's why women struggle with breastfeeding for up to 7-10 days, because there is low level of oxytocin, there is low level of prolactin, there is not able to breastfeed. So in that case, baby connection is very, very important. The moment you start hugging your baby more, you start being with your baby more, it will increase the oxytocin, and your body will understand the need of the baby, and it will start producing the breast milk. Okay, nowadays this is becoming common in case of normal deliveries also, because you are inducing labor. So some synthetic oxytocin levels are given, which drops because your body was not producing. It was given to you externally. That's why women are also facing problems in case of normal deliveries. They are not having breast milk for 3 to 4 days. Okay, so the more naturally you choose to go for the delivery, the higher the chances that your recovery is also going to be faster. The more interventions during your labor, the higher the chances that the baby would not have breast milk immediately, and your uterus is also going to take time to heal. Okay, so your uterus will be coming back to the navel size, to the navel level within 24 hours if you breastfeed, in case of normal deliveries. In case of C-section, it is going to take little bit more time. And even in emergency C-section, there might be oxytocin levels, but there might not be enough to let the milk out. So even with emergency C-section, women may struggle with breastfeeding for 4 days to 1 week. Okay, in such cases, you can always take lactation professional help. They will help you how to latch the milk, how to increase the hormones, and also if there are any medications required, they would help you out with everything that is needed for having the breast milk produced. Even Ayurveda doctors would help, because in my sister's case, her delivery was vacuum, and she was given oxytocin injections to progress into the labor, because her water was broken. So she was not able to, she couldn't produce breast milk for 2 to 3 days. Then we started with the Ayurveda medication, and then Ayurveda medication. So with the Ayurveda, some herbs and medication support, she started having within the next day, she started having breast milk produced. Okay. And also some latching technique she had started using that helped her also to let the milk out. So initially for 3-4 days, she struggled to breastfeed exclusively. After 3 to 4 days, she had come completely on the exclusive breastfeeding. Okay. So in such cases, you can take lactation professional help, you can take Ayurveda help that can naturally help you with increasing the breast milk production. Okay. So if you breastfeed, the moment your baby is out, when baby is ready to nurse, then your uterus will come back to the navel within 24 hours. Otherwise, your belly could be flabby, okay, bloated, loose. Okay. So for a few weeks, you may experience this. And the more you will progress into the breastfeeding, the faster it will recover. You are ready to start your sexual intercourse after 4 to 6 weeks. Can get back to. So once your vaginal bleeding has or postpartum bleeding has stopped and there is no discomfort, pain, or if you had a C-section, then after 4 to 6 weeks, you may go back to the having your physical relationship with your partner. You may cross-check with your doctor also. Depending on the stitches, if you have had any stitches in your perineal muscles, it would be recommended before getting into the any physical relationship, you ask your doctor when to resume back. Usually it is safe to resume after 4 to 6 weeks. Okay. And your cervix. So there is an internal opening and external opening of the cervix, just like any tube you would take. There is an internal opening, then there is external opening. So your internal opening of the cervix returns back to the normal size that you had your pre-pregnancy if you start doing strengthening practices, and Kegel exercises or Ashwini Mudra could be very helpful in bringing your cervix back into the shape. Okay, the external opening. External opening stays little open around half to 1 centimeter. So the external opening will never return back to the pre-pregnancy size. It will be half centimeter to 1 centimeter open. That's why the subsequent deliveries are faster, because your cervix is already a little bit open and your body has already gone through the process. So those muscles have a develop a memory, and it will progress into the next deliveries faster when you conceive second or third time, unless there are some psychological changes in a woman's body and the mind. Okay, so some psychological factor can make the second or third pregnancy harder. Otherwise, second or third deliveries are supposed to be easier because your body already knows the process. Okay, there were a few women who did the course from Nepal, and they say that there is a trend going on in Nepal. Women choose to deliver with C-section because they found out that after delivery, their husbands are cheating on them and dating other women. So because they have this mindset that their husbands are not happy sexually after you deliver, because the vagina becomes loose, the cervix becomes loose. So actually you can tone these muscles. There is nothing like that. You cannot bring your vagina back to the pre-pregnancy level. The internal opening will be similar. You can bring it to the same tightness. You can use those Kegel exercises, Ashwini Mudra, and especially you can do this in Setubandhasana. When you do Setubandhasana practice, you can continue your Kegel exercise or Ashwini Mudra contraction practices with your breathing in Setubandhasana. It will help tighten those vaginal muscles. It will bring the cervix back into the normal position and the size. External opening has nothing to do with the internal opening or your experience when your partner is having sex. So this is purely because of lack of knowledge they are going for C-section because they do not want their partners to cheat on them. So because of that, they had been going for C-section. So this you can explain, even if some such insecurities are there in their life, then you can explain them. This is just your muscles. They are going to heal and come back to the normal position and the normal tightness you will gain with the practices. Okay.
Nisha,
Yes.
it's true that if there is planned C-section, then the urge for doing the best breastfeed decreases.
Yes, because your oxytocin levels are low, right? When you do not have oxytocin, you are not connected with your baby.
Right.
It's all about oxytocin. Oxytocin is also the hormone that bonds you with your baby. Okay, that is a love hormone, cuddling hormone, and you would not have that kind of a love for your baby. So you do not care about the baby's need.
And not just about like pregnancy, otherwise also like are there any yoga asanas to improve your oxytocin hormones?
Oxytocin is it is a social bonding hormone. Okay, the more you feel love towards yourself and towards others, that is the way to increase oxytocin. So the loving kindness meditation that we have taught you, that is the best practice to increase oxytocin levels. Because sometimes we have disappointments towards our own self. We are angry with our own self, so there is no oxytocin. We have a lot of anger towards others, there is no oxytocin. So loving kindness practice is one of the best practice to increase oxytocin. Okay, yoga asana is not going to help. It can also make you obsessed with your physical body. Okay, it can lead to selfish love, not unconditional love. But the love you would have from loving kindness meditation, it will be unconditional love. Okay. Some other changes, your breast will be enlarged till the time you're going to breastfeed. Okay, you can expect up to 2 size change. So if you are having 32 breast before pregnancy, 32 size, then you can expect your breast size to be 34, 36. Okay, that is very normal breast change till the time you are going to breastfeed. They are going to be large. Some women would experience hair loss in initial few days of postpartum. Nothing to worry about this hair loss because you had all glowing skin and good hair during the pregnancy because of higher level of estrogen, progesterone. It's just that your old hair is shedding off, and that's why you have the hair loss, because now your estrogen, progesterone levels are going to come back to the normal level. Okay, so that leads to losing the old hair. You don't have to worry, it is going to stop within few days. So hair loss may happen. For some, the shoe size may change, alter. If they had swelling throughout their pregnancy, then their shoe size may also change. And before we want to start with any practices, we want to ensure there is no abdominal separation. So how to check? So suppose you want to start with postpartum class with any of your clients, it is it is important you can ask a person if the doctor had checked the abdominal separation or diastasis recti for them or not. If they had checked it, then it's good. If they hadn't checked it, then I would recommend you check yourself before starting with the exercises. Because now you're starting with postpartum, you want to focus on core strengthening exercise. And if they have abdominal separation and you start with some crunches or you'll start with some leg raises, the problem is going to just worsen. You start with some back bend or side bends, the problem is going to worsen. Okay, so you want to check for yourself. Okay, and there is one practice that you can start immediately postpartum to correct your pregnancy induced lordosis, to reduce the arch. That is the pelvic tilt. So I'm going to show that pose, but before that we will check the abdominal separation. So I need one volunteer who will show, who can lie down on a mat and can put the t-shirt up and can show it to everyone. I will instruct and you have to check how, I will tell you how to check abdominal separation. Yes, Ishu. So just arrange your camera and keep your screen close to you. Keep it down close to your mat so we can see you clearly. Bring your phone closer, even closer.
Yeah, just a second.
Or your mat, you can bring it closer.
Yeah.
Yes, yes, yes. Now lie down on your back. Okay, bend your knees, move your t-shirt, kurta up and pants down. Okay. Now, Ishu, you're going to use your fingers, like 2 fingers. Okay, can you see me? 2 fingers. Okay. And now bring your chin to the chest and lift your chest up like you do crunches. Bring your chin to the chest. Yes, stay there. Now press your 2 fingers above your navel vertically. Like this. Press it like this. Like this. Like this. Yes. Above your navel.
Yes.
Above your navel you're putting? Yes, keep your fingers like this and put it like this.
Yes, I've done this, ma'am.
Yes, not like this, like this. You have put it like this. Yeah, turn like this.
Okay, like this?
Yes, yes, like that. Yes, yes, like that. Is it going inside? It is sinking in?
Yes, ma'am.
No, if it is sinking in, you need to see if it is going inside. All the entire finger is going in, or something is stopping you.
No, something is stopping.
Yeah, and now do the same below the navel.
Yeah, it is not going inside at all. Below.
Yeah, something is stopping. That means there is no separation. If there is a separation, your fingers will go inside and you will feel that it is just synced in and there is nothing that is stopping you. It is going to go in. Okay, thank you.
How much it will go?
It can go inside completely, or the whole finger will sink in. There is nothing that is stopping you that it bounce back.
Okay.
Okay, so right now I'm pushing, I'm sinking, but it is not going. But when there is it will go like this.
Okay. And you have to do this in inhalation or exhalation?
No, breathe normally. Just
No.
you lift your upper body up, so your muscles are tightened. When they are tightened, then you will be able to see. Okay. When they are loose, they will go inside and you will not be able to feel it. So you have to, like you're doing half crunch, you're bringing your chin to the chest and lifting your body up and tightening your abdominal muscles and doing it. Okay. So if it is sinking, then you will see whether it's 1 finger gap, 2 finger gap, 3 finger, or the entire hand is sinking. How wide is the gap? Okay. So in such cases, if there is a gap, you need to contact the physiotherapist and check how severe is the condition and take the suggestion what all practices can safely be done. As we have discussed, side bends, back bends, and spinal twists are the contraindications for this practice. And we can just do belly pulls, like pulling the belly towards each other gently, like we have done it before. This is one of the exercise that can be safely done. Okay, and Setu Bandhasana with the block support. Okay, that can be safely done. Or in the Anantasana with the knees bent, keeping the feet and lifting the knee up. Okay, that exercise can be safely done. So you can cross check with the physiotherapist and then do. Otherwise, the condition will worsen. There was one Nepali student, yoga teacher, who didn't know she had abdominal separation for many years. After doing the course itself, when I was telling the symptoms that whenever you're doing some core exercise, instead of your belly toning, it is just going out and out. That time she realized that she had been working out, but her belly is just going out and out. And she is looking more like a pregnant woman. That time, during the course itself, she went to a physiotherapist, and then physiotherapist checked her and said she has diastasis recti. That time she came to know, and she had delivered many years ago. 7-8 years ago she had delivered, and for all this years she didn't know she had abdominal separation. Okay, but she was having back pain. She was doing exercise, but then belly was not toning. Instead, it was coming out only. Okay, so you need to understand, you need to be safe. If you, without measuring, if you start giving them the exercise, there are chances you can worsen the condition. So to be on the safe side, you're going to measure. Okay.
And one question,
Yes.
the abdominal separation can happen in both C-section and normal delivery?
Yeah, it can happen. So we want to check for postpartum both, C-section and normal both.
And like whenever a student come to us, do we need to check this or do we need
Usually,
to
usually doctors are supposed to check.
Okay.
But if doctors are not checking these days, doctors are not checking at all. Like my sister, usually postpartum, they used to have 6 weeks checkup. Okay, but for my sister, she was checked only once after 1 week of delivery. And I asked her, when is your next checkup? She said, no checkup. So even we don't know her stitches have healed or not after vacuum. Okay, we just have to assume they have healed. There is no, so it's just that country wise there can be different rules, but ideally they usually have checkup around 6 weeks and they check if whether you have diastasis recti or not. But if they do not check, it is important for us to be on a safer side. We should check for them.
So how much is the percentage of diastasis recti? Like how common it is?
It is, you can say around 20-25%.
Okay.
Okay, not very common. Like you will not find every other woman coming with that condition. But somebody may come and then if you do not know that lady has diastasis recti and you start giving the postpartum exercises to tone the abdominal muscles and strengthen, it may just worsen the condition. Okay. So Ishu, once again, go on your mat. I'll just show the exercise that is Important to reduce the postpartum lordosis, the pregnancy-induced lordosis that happens. We will do this exercise as soon as you feel the pain in vagina has gone, and this is safe also after C-section. So you can start this exercise after C-section after 8 weeks, 7 to 8 weeks, and in case of normal delivery, you can start after 5, 6, 7 days once the pain has reduced in your vagina. So now here your issue, you're going to tuck your tailbone in and press your lower back onto the mat. Continue to breathe. So this practice you can also call like gentle Uddiyana Bandha, but this is not Uddiyana Bandha. Whenever we are breathing, there is no Bandha. Okay. But in Ashtanga, you may be used to saying that make abdominal lock, abdominal lock. Okay, this is kind of a gentle abdominal lock. You have to tilt your pelvis, like you need to tuck your tailbone in. There is a posterior tilt of the pelvis and press your lower back onto the mat. And you will see your back is touching on the mat, pressing on the mat, and continue to breathe normally. No need to hold the breath. This exercise you can do for start with 5 to 7 breaths, and then gradually you can increase the number of breaths. And then slowly you can get into the Marjari Asana where you're doing the tucking of the tailbone and engaging the core. That is also going to be one of the best exercises to reduce the arch, tone the muscles. Yes, Ishu, thank you.
So, ma'am, knees will be bent in this or straight?
Knees bent.
Okay. And I think this exercise will help in improving the posture post-pregnancy also.
Sorry? During pregnancy, we are
exercise
not
which you
doing
just
this.
told.
It can compress the inferior vena cava vein.
No, I'm saying after like postpartum, when we do this exercise, this will help in improving the posture also.
Yes, it will improve the posture, reduce the lumbar arch, and also at the same time, you're toning the abdominal muscles because you are engaging your abdominal muscles. But this is not as intense. This practice is also good for diastasis recti. You can also give this practice for people with abdominal separation. Okay. So when you are not like when you are having your postpartum bleeding going on, when you are on your menstruation, you may not be able to do Setu Bandhasana. This is a nice pose and you can immediately start after 5, 6 days, 7 days. Once the pain has reduced in your vagina, you're able to go down or sit down. Even you can do it on your bed. Only thing is your mattress should not be a spring mattress which is going inside. If you have a little bit not that soft mattress, so that solid mattress you have, you can do it even on the bed. So you can start once the pain little bit reduce in the vagina, and in case of C-section you can start after 8-9 weeks. Okay, any questions?
Can you repeat like after C-section? After
You can start after 8 weeks.
8 weeks. And even if there is bleeding going on?
Bleeding will stop up to 6 weeks, and this pose is not an inversion. So you can even do when you have your menstruation. Okay, so now you have to go through the manual, those protocols that are given for the postpartum. You go through it today, okay? And tomorrow we will not be meeting, but whenever we meet, if you have question, you can ask me again.
Ma'am, I have one question. Can I ask now?
Yes.
But that is not related to postpartum. It is prenatal question.
Yes, then hold on. You can ask me towards the end of the class.
Sure.
Okay. So if you have the question for the postpartum, you ask. Otherwise, we'll take a break and then we'll discuss postpartum depression and then breastfeeding. Okay, so just take a break and let's come back in 7-8 minutes. Shall we start? Okay. So postpartum depression. What is this postpartum depression? So what is postpartum depression?
Any emotional problems that women face after delivery.
Women will face a lot of emotional things. It can be anxiety. They'll feel overwhelming because of too much of things and sudden responsibilities put on them.
Have you all heard of postpartum baby blues? What is postpartum baby blues?
Suddenly they'll feel happy for suddenly their emotions will be too extremes.
So postpartum baby blues is a trailer of depression, you can say, because it is okay after maybe 5 days, 7 days. Within a week, your postpartum baby blues will go away. You are grieving for the baby that you have lost from your womb. Though your baby is healthy and safe in your arms, but still you're feeling that you have lost something from your body because you had been carrying your baby for all these months. So you felt that you feel that this you something that was there inside that is lost, and you're not able to connect with your baby. And the more you start breastfeeding, oxytocin levels will increase, and automatically you will feel this is your baby. Your baby is safe. You have not lost anything. So the postpartum baby blues goes away. And postpartum depression is a condition which can appear anytime in the first year of postpartum period. It is not like something that may happen just after you deliver. It can even happen after 6 months. It can even happen after 9 months. So postpartum depression can come within the first year of your postpartum period. Okay, and it can appear anytime, and it is like it is a mix of feeling. You may feel anxious, you may feel overwhelmed, you are conscious about your own body, you do not like the way you look, whatever is going on around you. So there are a few causes of postpartum depression. The first and foremost cause is the hormones, because your estrogen progesterone levels were higher when you are pregnant, and as you deliver, both these hormones go down and come back to the normal. As we have discussed, the estrogen progesterone are the one, if they're balanced, they give you a good mental state. The sense of calmness is there and sense of alertness, both of them are there, so it is balanced. At the same time, oxytocin, if oxytocin levels go down, then it can again lead to creating problems with connecting with your baby, creating, you're so exhausted, you're so overwhelmed that you are not now even able to connect with your own baby. So that is because, again, that declining level of oxytocin, and your progesterone and oxytocin are also dependent on your sleep. The better your sleep, these hormones are also going to be good, because your sleep cycle has a close relationship with this hormone. So you will see postpartum initially, first few weeks or months, your sleep is very much disturbed. So there are Actually, I would consider two major causes that can lead to postpartum depression. One is the hormones, second is the lack of sleep. Okay, so you're waking up multiple times in the night, that is affecting your hormones, and that is also making you feel tired throughout the day because you're trying to fulfill the needs of your baby, trying to fulfill the needs of the family members that you have in your house. So there are two major causes of postpartum depression. Okay, hormones and sleep. Okay, if you want to prevent postpartum depression, the best way to do is breastfeed. Breastfeed and rest. Get sleep, proper sleep. These are the two things that you need to focus on in postpartum. So whether you do a lot of asana practice or not, but whenever you get a time, it is important you focus on deep relaxation and yoga nidra practices to help recover the loss of sleep that you have throughout the night. Okay, so breastfeeding and rest and sleep are the two main preventive measures postpartum that you can focus on to prevent postpartum depression. This condition is becoming more and more common in the modern society, modern like all the metro cities, because there is a hormonal issue, there is a sleep issue. The third one that affects is the support. Now in nuclear families, there is no support. Otherwise, when our parents were living in a joint family, the children grown up, our grandparents, they had, like my grandmother had 7 children. How they would have grown up, nobody would know because they were all living in a joint family. Okay, so there is a support system who is taking care of a lot of things when you are not able to give full attention. Now we have smaller families, especially the couples who are living outside India. They may not even have their in-laws or parent support in the outside country. So sometimes they're on their own. Some mothers are single mothers. So they have a lot of more lack of support that can lead to overexhaustion. So postpartum support is very, very crucial. Either the mother, either the sibling or a nanny or any professional help also would help here. So if support person is there, then even if the baby is just awake, you have breastfeed, you can give your baby to a support person and you can get some sleep. Okay, so you can do like turn wise. If the support person can be your husband. If you're not having that kind of a husband, then it is always good to have some other support person who can help you with some activities in the house with the baby, and you both can alternatively rest while taking care of the baby. Okay, support person is very important. The other causes that can lead to depression, the financial issues. If there is no enough financial support, that can lead to postpartum depression, because there is increased demand of the finances to take care of the baby, the new member in the family. The relationship with the family, husband. Okay, so how is your relationship with your in-laws, your husband? If you do not have a good relationship, then they would not understand uh, what you're going through, what you're facing. They would not have that kind of an empathy. So if they do not have empathy towards you, you will be getting exhausted fulfilling all the demands. Okay. If a pregnancy was out of some abuse, Okay. If there is any abuse in a relationship or the pregnancy was out of some abuse, and in such cases also, a mother will have difficulty connecting with a baby and there is no oxytocin level, it is going to lead to postpartum depression. Okay, your body image, how you look, okay, that can also put you into the depression. Okay, women, those who have extreme mood swings, like 5 minutes before they were very happy and just with little bit some negative thing, they get affected so much, like they have their moods going up and down like two extremes, okay, and too quickly. Those women are also prone to PPD. Okay. Also, those women who experience a lot of PMS and a lot of mood swings during menstruation, those women could also have chances of postpartum depression. Okay. Women with C-section could also have higher risk because not having enough oxytocin levels. Women who are not breastfeeding. Sometimes people feel breastfeeding is an outdated thing and should not breastfeed, but breastfeeding has a lot of benefits for mother and baby both. Okay, so if a woman is not breastfeeding, then it can lead to issues like postpartum depression. Okay, so these are some causes of postpartum depression. Now, how yoga can help with postpartum depression? What all practices you can focus? So it will just vary in which term they are into their postpartum. Okay, if the postpartum signs you see very early in the postpartum phase, like in the first term, then of course you will be going gradually. But always understand what they need most is the belly breathing and a lot of relaxation. The more they will do belly breathing and the more they will practice yoga nidra and deep relaxation, their weight loss, even if it is associated with the body image, their weight loss will be better. Okay, so first of all, ensure they are doing belly breathing. Ensure they are getting proper rest so their hormones like progesterone and oxytocin increase. Okay, so rest is very important. First, you focus on joint movements, do the sukshma vyayam so the blood circulation is increased, and do a lot of belly breathing and just do shavasana. That is how you can start. Do not give them meditation practices like we have also discussed during psychological issues when we're talking about pregnancy complications. For these people, movement is important. But at the same time, for these people, relaxation is very, very important because 50% the major cause of the PPD is not getting proper rest. Okay, 50% is contributing not able to take rest properly. That is the 50% contribution. 50% could be all the other factors. Okay, so the moment they start relaxing, they start resting properly, their hormones will also get better. Belly breathing will help stimulate parasympathetic nervous system, will switch off the sympathetic nervous system. So if they're feeling anxious, the anxiety will reduce. They're feeling unnecessarily overwhelming thoughts, that will go down. Okay. So joint movements, belly breathing, and relaxation, that should be the first protocol. And then slowly, the more you will see after 3-4 days, they're feeling a little better. They're feeling a little bit more energetic. They're able to connect with their baby. then in that case, you will start with some more asana practice, gentle asanas. You can start with now Ujjayi and Brahmari pranayam. Then you can start with baby connection practices. So you can start with baby connection meditation and mantra chanting. So all this parallelly, slowly, you're going to increase. Okay. First of all, we want to relax her. So always focus on deep relaxation, but your relaxation should not be more than 15-20 minutes, because initially they may not be able to relax for a longer period of time. Okay. So just start with 15 minutes of deep relaxation, and then gradually you can increase the time of relaxation. Any questions with postpartum depression?
Is this
Okay.
Yes, Anju, go ahead.
is this clinically diagnosed or?
Yes, it is clinically diagnosed. But most of the time, most women are not educated that they have postpartum depression. Okay, so they, or maybe even if they know they have depression, but they may hesitate in asking for a proper help. Understand that the postpartum depression not just going to affect a woman, but it is also going to affect a baby. Okay, initial few years, the connection with the mother is very, very important in terms of a normal development of a child. Okay. If initial few months or a year, if a mother is not able to give the love, warmth, affection, that security, the child will be born with a lot of insecurity, lack of confidence, lack of self. They will not have that kind of a self-image confidence. They will have body shaming. They may not be able to talk in public. They have a lot of phobias. So they may not be developed. They may not grow as a secure child. Okay. So initial, and I've seen the effect, like some patients, the roots are lying at their childhood where they're growing up. Okay, the problems were there in the way they had been brought up. So there was a case of a mother around, that patient is around 43 years old. And if I was trying to understand his psychological state, then over a period of asking him, giving him therapy, I found out that his mother had a postpartum depression, and his mother is still not stable at this age. Also, his mother is, I probably might be above 75. Still, his mother is not stable. This guy had divorced, and his mother didn't even ask what happened to your wife, why all of a sudden your wife disappeared. Nothing, no questions. She doesn't know anything whatever is going on in his life. And she's not crazy also. She doesn't talk nonsense or nothing like that. uh, but she is not having that kind of connection also, that she can feel what what her son was going through. And he has grown up with a lot of insecurities, instability in the mind. And to give a therapy to such person, it is very hard, because unless and until some professional help comes along, then only the yoga therapy would work, because they lack dedication to come into the class every day. Okay. So some roots you will find a long time ago, that the way they had been brought up. And at that time, like 43 years ago, nobody would have known what is postpartum depression. Okay. Now we are becoming more aware, and this condition is also becoming more and more common. That's why the awareness is still there. So, and this is now affecting everyone. The cases are rising of postpartum depression. So you have to be aware. If you see some symptoms where a woman is not able to connect with the baby, not breastfeeding on a regular basis, she is going through a postpartum depression. Okay, because it is going to immediately affect the breastfeeding to a baby. Baby is crying, she would not care to calm the baby, not want to find out why the baby is crying. She might be oversleeping. She might she might not want to do any work. Okay, don't even want to hold the baby, don't want to breastfeed. So these are some signs and symptoms of postpartum depression. Okay. So always take a professional help if it is very, very severe. Don't just say that, okay, we will heal with yoga. Okay? It can go parallel. Yes, Kirti, you had a question?
Yeah, ma'am, I have seen women like they claim that once we have a C-section, then the belly fat, it's not possible to decrease it. So we try to convince them, but still they are like, no, once we are operated, the C-section has been done so that belly muscles, the extra fat will not go. So is it true?
No, there are issue has given C-section birth. Who else has given C-section? No, it's not true. I had my clients who had given C-section birth.
I had a case, she was a lady from
Preeti
US.
has given C-section. It's just in the mind, and if you do right practices, some of my clients who had delivered C-section, they are just looking pre-pregnancy body. They have now the pre-pregnancy body type.
I had a case and she is in US and like she was very thin, but after having C-section like 2 times and her belly, it was like loosen up the muscles. So she was very good with her yoga and everything and she was a regular practitioner, but still she could not get rid of that extra belly.
No, it could be hormonal in that case. It is not the C-section. Okay, so she needs some more rest. The more she will rest, the hormone, thyroid, and all the functions will get better, and she will be able to lose the weight. The fat will go. Yes, Ishu.
Yeah, so I was just answering Kirti's question. So I myself lost 28 kgs of weight after delivery, and I am slimmer than I used to be before pregnancy. And even the belly fat has gone. It's just a little bulge, but it is very little. But most of my belly fat has gone through yoga practices.
Okay, so postpartum rest is very important. The more you rest, the hormones will be balanced properly, and it will not create any issues like you will not have, yes, C-section recovery is slower. Uterus will take little longer to recover compared to normal delivery, but it is nothing like that you will be fatter than what you were before. Okay. Yes, Kriti.
Yeah, same. I also wanted to add with the issue. I also lost like 20 kgs with only doing yoga, but I took time. I wanted a rest. I know my body wanted rest. I took 1 year time after my C-section, and after 1 year only, when I thought I'm ready for yoga, and then only I started. And in 1 year, I lost 20 kgs, and I'm back to my pre-pregnancy. Before marriage, how I came like that. But then the rest part is very, very important. That only you know how your body well. So the individual person should decide when they need to.
Same with me, like I waited for 1 year, and then after that, when I felt I'm ready, I lost 28 kgs in the span of 1.5 years.
Okay, you will not lose weight overnight. You have to keep patience, and women usually do not have patience after they deliver. They want to be normal. You have taken 9 months to grow a baby and deliver. At least give yourself 9 months to come back to a normal shape. Okay, so you can just explain that way. It has taken 9 months for your body to be here. So give 9 months for your body to reverse back. Okay, so just you need to give some time and then do right exercise, do proper resting, eat healthy, it will go away. And women also start dieting postpartum while they're breastfeeding. That is completely wrong. When you're breastfeeding, you are supposed to eat more because your baby is growing faster, your baby's weight is more, and baby's demands are more. So your body needs more food to feed the baby. Okay? And the more you will breastfeed, the faster the weight will reduce postpartum. Okay. Any questions with postpartum depression? Okay, so yes, Preeti.
I'm sorry, ma'am. For some people who go through postpartum depression, their anger would be on the kid, on the
Yeah.
child they delivered. So at that time, how does child connection helps? What kind of
No, that's why we are
meditation?
not doing the first thing. We are not doing child connection. First, what we are doing is belly breathing and only relaxation. Okay. When they are not depressed, they will not be able to connect with anyone. Okay. So first we want to do joint movements, some simple spinal movements and belly breathing and deep relaxation. After 4-5 days, you feel they're feeling a little better. They're feeling less angry. Their energy levels are better. Then add some more movement, add Brahmari Pranayam, add Ujjayi Pranayam, and then you will add the baby connection practices. But you will not add baby connection practices that way. You will first start with forgiveness. Then no, don't start with forgiveness, start with gratitude. Start with gratitude, then add forgiveness, and then connecting with the baby, sharing the blessings with the baby. Okay. It is easy to still practice gratitude. Forgiveness will come hard. So first you need to be grateful with what you have. Okay. Once you feel grateful, automatically you will start feeling better. After doing gratitude practices for 2-3 days, then add forgiveness. After doing forgiveness practices for 3-4 days, 5 days, you feel they're feeling happier, they're able to connect with the baby, then start with sharing the blessings and connecting with a baby. Okay, so you divide that loving kindness meditation in 3 parts. That's what I also do with my patients. Whenever I have some chronic disease patients, it's not easy to practice forgiveness when you're going through a lot. Okay, first of all, we need to realize whatever we have more than enough. So first practicing gratitude, then only forgiveness. Any questions? Okay, so we are going to discuss the lactation, breastfeeding. As I said, minimum breastfeeding condition is 4 months, but recommended period is exclusive breastfeeding 6 months. After that, it is mother's and baby's choice how long you would like to breastfeed and how long baby would like to breastfeed. So it is a mutual decision you can take depending on how you are feeling, how is your schedule, and how is your baby, also what is your baby's demand. Okay, your breastfeeding works on demand and supply. The more the demand, the more the supply. Okay, so even if that's what I had been telling my sister, even if you are not having the milk coming, you keep the baby and let the baby suck. Whenever the neurons, the nerve cells in the around the nipples will check the saliva, sense the saliva coming out of the baby, it is going to send a signal to the brain that your baby needs milk. You need to produce milk. And it is also the way you connect with your baby. Okay. The moment you hug your baby, keeping your baby at the chest, it is going to have some kind of connection created. So you're going to it is going to help produce breast milk. So initially my sister was like, it is not coming, it is not coming. She was not putting I said, I scolded her. You have to, even if the milk is not coming, don't just say milk is not coming. Just keep the baby for 2 minutes, 3 minutes. Every time you want to feed the baby, you feed the formula, no problem. But first let the baby suck the nipple. Even if the milk is not coming, let the baby suck the nipple. Your body will understand that your baby needs the milk. So it is automatically going to produce. And that's what happened. After 2.5 days, she started having little milk. Though the quantity was less, but it started producing without any medication. And then we on the 3rd or 4th day, we started with the Ayurveda supplement. Then she completely went exclusively on breast milk after her milk production had increased. So you need to give, it works on demand and supply. After 6 months, it is up to you. If you want your baby to feed continuously, then you can keep. Otherwise, you can, if you're feeding 8 times a day, you can make it 6 times a day. Then gradually 5 times a day, 4 times a day. Like that, you can reduce and parallelly start feeding your baby. So that's how you can reduce the demand. Your body will also automatically reduce the produce. And your baby also at the parallelly starts eating something. So you can gradually reduce how you want to stop. And if you want to continue to breastfeed for a longer period of time, if you are able to, you can continue. It will be on demand. So your body, only in some cases that happens that naturally your body stops producing, and your baby, it is mutual. Your baby may also not want it. That's why your body is stopping. Okay. So usually it is going to work. The amount of demand is there. The same amount of milk is being produced in your body. Okay. Breast milk, the first milk, it is very, very crucial. The first milk that comes out, it is called colostrum. Colostrum is a very, very important milk for the baby to prevent jaundice. Okay. You will see because the first milk, you will see it is yellowish in color. And the first milk is high in protein that helps with the first bowel movement, and it clears the liver. So it reduces the risk of baby contracting with the jaundice. Okay. So those women who are not able to breastfeed immediately after baby is being born, within 2-3 days or the same day, if the babies, they're not feeding for 2-3 days, they're not able to feed because the milk is not coming, those baby will have a jaundice. Because the moment the baby is ready to breastfeed, if you feed, the first milk is very, very important to create the first bowel movement. Okay, so it can reduce the risk of also SIDS, that is sudden infant death syndrome, that happens after a few hours of baby being born. So if you feed the baby as soon as baby is ready to nurse, it will reduce the risk of baby dying after being born within few hours. Okay. Baby's jaw development is also going to be better if you breastfeed. Baby will have less allergies. Baby will have less constipation, diarrhea issues, because the mother's milk is the best milk that is not designed exclusively for your own baby. Okay. So whatever your baby needs, that is your body is going to produce. So if your baby needs fat, your body is going to send more fat into the milk. If your baby needs some kind of antibodies, your body is going to produce that antibodies and send it with the milk. So your breast milk contains carbs, fats, proteins, all micro macronutrients, all minerals, all vitamins. Okay, it contains hormones. So whatever hormones that are there in your body, same hormones are going to go into the breast milk. So if you are angry and you will feed the milk, baby is also going to receive some stress hormones into the body. If you are happy, all happy hormones will go with the milk. Your baby will also be very happy, will not be cranky, will not be crying. So it just depends on your state of mind. Your state of mind is going to affect the hormones in your body. Your hormones will be sent to the baby, and those hormones will affect the baby's state of mind. Okay, so hormones, antibodies. So now suppose you may have some antibodies in your body that you are readily sending with the breast milk, but sometimes you may not have come in contact with some disease, but your baby has come in contact with some disease. Now what happens is your baby is sucking the nipple, and then that saliva is sensed by your body. Okay, so if there are any virus, bacteria in that saliva, if your body, if your nervous system sense that there are some pathogens, there are some virus, there are some bacteria, then your body is going to actually produce those antibodies and will send it with the breast milk. So it is also going to help baby fighting the disease that you may never have come in contact with. Okay, and your baby's need will be different than the other's baby's need. So nowadays the mother milk donors have increased because there are sometimes a shortage of the milk. The baby have lost the mother, so they do not have the breast milk. So some donors are there, but understand the milk may be similar in composition, but not exactly what that baby needs, because the baby's need is identified every time the baby sucks the milk from the breast. Okay, and that's how every time the feeding will change depending on the baby's need, and as the baby is going to grow bigger, the needs will change. The early milk, the early phase of breast milk may contain more fat than the protein. Later term of the breast milk that you're feeding, like after 3 or 4 months, there might be more need of protein. And depending on the girl and the boy child, their nutrition need is also different. Boy, for the development of a boy child, there is more need of the protein, and for developing a girl child there is a more need of fat in the milk. So the composition from a girl child to boy child also varies. Okay, so that's why cow milk or goat milk not the same. Understand, a cow or a goat, their growth rate after 40 days, they are not dependent on the mother's milk for their growth. So their growth is like they just need to be on the mother's milk for 40 days. After that, they're ready to eat. For human babies, they need to be exclusively on the breast milk for 4 to 6 months. So imagine the growth rate. Humans grow at a slower rate than the cows or the goats or the buffaloes or any other animal would have a growth rate. Okay, so cow milk has higher protein content that is not digestible by your baby and can create digestion issues. So all this milk, outside milk, are not going to be helpful. Only the mother's milk that is right for the baby. So understand the composition you have in the food formulas. They will be nutritious, but they will not have those hormones that you will have. Okay, those antibodies will be missing. Some antibodies might be there, but some antibodies will not be there that you can provide from your own body when the baby needs it. Okay, so the ready-made formula also is not going with oxytocin. The moment you breastfeed, you have that oxytocin running in your body, so it just improves the love and connection and that hormone in the baby also. Okay, so it is very important that you breastfeed your baby exclusively for 6 months for immune related issues, for better digestion. And also you will have, if you are working, you will have less doctor's visit with your baby, or you will not be facing those issues where babies are cranky and crying all the time because of digestion issues. And if you are as a mother, you are going to be very calm and happy while you're breastfeeding. Understand your babies are also going to be very calm and happy throughout their growing up. Okay, so I came across a very beautiful article about African babies. It was saying that there is a saying, African babies do not cry. So I read the article, and then in that article it was said that African babies do not cry because what they do is whenever they see their baby is slightly getting awake, they start breastfeeding. They do not wait for the baby to wake up and cry for the milk. Okay, so when the baby comes into the half conscious state and getting awake, they will immediately feed the baby. And the more the baby would sleep, the better the growth will be. So there is no crying. So there was a saying, and that lady was from Africa but living in US, and she had seen all the US baby crying, and then her mother was saying that African babies do not cry, and then she shared the secret how you can avoid all those issues that baby usually face or mother usually face. So you can avoid the scene where the baby, you wait for your babies to cry and ask for the milk. So the moment you see your babies are waking up, just breastfeed and they will again go to sleep. And that way you can be also relaxed and baby can also be sleeping and relax, enjoy their own growing period. So that's how African ladies actually care for their baby. And they say that exclusive breastfeeding for 1 year. So it is up to you what you want to do. I was breastfeeded for 2.5 years, exclusive breastfeeding. Only around 2 years only. After 2 years, my mother had started feeding me because that was the only time she could take me in her hands because she was living in a joint family. So she didn't want to miss the chance where she would not be able to take me or play with me or be with me. So breastfeeding was the only time she could actually hold me. So she wanted to have that connection. And you will see that different connection a mother would share. Like my mother specifically, I have a different connection with my mother than my sister would have. Though my sister is being pampered a lot for many things, but when it comes to trusting for anything, all the responsibility, everything, understanding, and that space that I have in my family, and the confidence they have in me, it is more in me than my sister. So if any important thing, it would be me they would look for. And the other things like all pampering and everything will go to my sister. So it's just like completely different the way they would share their love and understand. And my mother always felt when I would travel and teach and when I would go traveling, and sometimes if I'm traveling solo, and she would always feel that I'm living her dream because she wanted to do something like that in her life. So unconsciously, consciously, that has been with me and has come onto me, and she feels that I'm living her life that she might have lived if she had a chance. So some different connection, and I'm also more like my mother when it comes to the emotional like aspects. I'm more like my mother. My sister is more like my father. I don't know if it is breastfeeding or what, but just some my mother was good with mathematics, so I was good with mathematics. My mother was good with painting and sketching, so I was by default good. And my sister, none of them, not average with maths, average with painting or sketching, nothing extra. And her brain works like my dad, always logical. My dad is a lawyer, so always thinking in that way. So she has also studied law, and her brain also works like that. So just some differences you will find. I don't know why such differences. It could be breastfeeding because I was breastfeeded long time, or it could be something else. Yeah. So some differences you will find the way you have been brought up in your life. So this could be breastfeeding, and some very important aspects of breastfeeding is like you do not have to heat the milk. If you are even pumping the milk, you have to heat it and again bring it to the temperature and feed it. Okay, that is too much of work. No sterilize needed when you just have to clean your breast properly after every feed. That's it. And you do not have to worry that you have to heat the milk or keep it in the fridge. You just, whenever your baby is hungry, you can breastfeed whenever you want. Don't have to carry bags of all the baby food with you when you are traveling. You just have to carry yourself with your baby. You can breastfeed, very convenient, very economic. You are not spending money on baby food products because you're breastfeeding, you save a lot of money. Okay, it is eco-friendly if you are conscious about not polluting your environment. You're creating zero waste out of breastfeeding, no waste created. If you're having baby food, then packs, everything comes in plastic and boxes. You're creating a lot of waste. So that way also you can, giving back to the environment that way. protecting the environment if that matters to you. Otherwise, your own health is also going to be very important for you. Actually, breastfeeding, as we discussed, it can prevent postpartum depression. Breastfeeding also reduces the risk of uterine cancer, ovarian cancer, or breast cancer as you come close to the menopause. So it reduces the risk of getting cancer in the future life for you. Okay. Breastfeeding will also help you get back to your pre-pregnancy body faster. If you breastfeed, your weight loss will be faster, your recovery will be faster. Okay, and you will be happier, you will be proud that you are able to grow your baby, you are able to fulfill the needs of your baby. It will just make you feel stronger as a woman. Okay, you created the life inside 9 months and you are able to even nurture outside. That just gives you a different power. Okay, so it can make you feel stronger as a woman. And yes, your breastfeeding, as we have discussed, is very it is going to change as you progress into the breastfeeding. And one if you have twins, like issue has twins, you have both girls, or a girl or a boy?
And boy and girl.
Yes. So now she has one boy and girl, and you would not believe how intelligent your system will. Ishu, can you tell me, your baby girl and boy were growing same while they were breastfeeding, or
So
they were growing differently?
actually, it was not much of breastfeeding because I don't know, maybe many reasons. So they were mostly on the formula milk actually.
Okay. So if you have girl child and boy child, and if you're breastfeeding, you will see their growth will not be similar. Okay, some your maybe the boy child may start crawling faster or speaking faster, or girl, it just varies, and the height and the body proportion, the fat deposition, the height, body weight, everything will be little different how they're growing. If they're breastfed by the same mother, how they're growing differently, because their needs are different and their growth rate is different. So if you're breastfeeding two babies, on one baby on one breast and the other baby on the other breast, one side baby girl, one side baby boy, your body will identify from the saliva the actual need. The body would not know that this is a baby girl or this is a baby boy, but from saliva, the body would know that this breast needs to have milk with more fat, or this breast needs to have milk with more protein. And the same will be provided for your baby. That is the baby's need. So even if you're feeding twins at the same time, the milk quality will be different. The composition of the milk will be different as per the baby's need. And there are a lot of researches now being done on this aspect. They had done this research on the cows. When a cow has a female calf and the male calf, then the same cow was producing milk differently to give the milk to the female calf and to give the milk to the male calf. The composition was different, and it is believed the human body does the same. So this is open for research. There are some researches already going on this aspect. Okay. So if a baby develops some indigestion issues, the best way to find out is by eliminating one food at a time. Suppose you ate chickpeas today and you immediately found out your baby is crying and having indigestion, then you need to stop eating chickpeas. You need to find out from your diet that if your baby is not able to digest certain foods, then you need to eliminate those foods. Okay.
Also, ma'am, adding to your point, not just breastfeed, like I just breastfeed for a couple of weeks. And apart from that, like they eat everything same. Okay. Their food time is same. Their sleep time is same. They eat same food every day, but they are completely different from each other.
Yes. Okay. So their genetical structure from the time they are being, the genes are different. They are not carrying the same genes. Okay, some different genetical structure has formed for the baby boy. Some different genetical structure has formed for the baby girl. So depending on the what kind of genetical structure has formed from the mother and father here and here, their characteristics, their attributes, the way they behave, the way they grow, everything will be different. Okay, even if they're identical twins, if they're sharing the same placenta, still because their genetical structures are different. Okay? So early few years, your genetical structure, like up to 3-4 years, your genetical structure is the one which is going to be influencing your growth. After that, once they are getting more familiar with the environment and when they start eating food, okay, then the external environment also starts putting some effect on their genetical structures and their growth and every development. Any questions with the breastfeeding? So there, you shouldn't be breastfeeding if you have when you have a coffee. Don't breastfeed when you have alcohol, smoke. I've seen, like while I was traveling in Australia, I've seen there was one lady in a restaurant. She was holding an infant, and she was drinking a beer and she was breastfeeding at the same time. So I just don't know, but all these things are not advisable. So should not smoke while you're breastfeeding, should not drink, avoid caffeine, avoid those foods that can affect the baby's growth and development while you're breastfeeding. Try to go easy on your digestion, the foods that are easily digestible. And initially, you're supposed to eat some food that is rich in fat because your baby's need for fat is higher in the early couple of months. Okay. So, and also fat is the composition that can help baby sleep longer. Okay. If you would not be eating fat in your diet, then your baby will also be very light sleeper and the growth will be affected. Okay. So it is very important you consume, and coconut usually here in Gujarat, I don't know other places, in our culture, we give a lot of coconut, that you have dry coconut. So breastfeeding mother should eat coconut every day, 3-4 pieces of coconut while you're breastfeeding. So if you feel you're experiencing some indigestion while eating coconut, you can also have coconut milk. That will be easy on your digestion. So depending on the state you are in, you will have your own. Best way to know is from your mother. Okay, your mother would know the best. And if you have to apply something or some ointment on your nipples, you can use ghee, because a baby might not like the taste of castor oil, so you can apply ghee. Okay, that is a nice thing. Do not apply those lubricants that are available in the market, but no matter how organic they claim to be, probably if they have some kind of mixtures there, some chemical components are there that should be avoided. So ghee is the one that is ideal. You can take cow ghee and just apply it. Any questions? Yes, Anju.
So what about expressing milk? Let's say if it's a C-section, then the breastfeeding is
Yes.
not right away. So are you able to express colostrum and then feed it later?
It will, you see, milk will not come out when you have C-section. It will take 2 to 3 days. So just feed the baby, let the baby suck the nipple, and colostrum will come. The first milk will come, it will be colostrum. Even if it is coming after 3 days, it will be colostrum. Okay, so colostrum, the first milk that will come, it will be the colostrum. Whether it comes after 7 days or 3 days, doesn't matter. Okay. Yes, Preeti.
Ma'am, I just want to add, I had a C-section, but I fed my baby immediately. He's 2.5. I still breastfeed the baby. That now it is on demand. But then when I had my C-section, immediately after the stitches is done, I requested the doctor, I want to, breastfeed the baby within 30 minutes after my C-section is done. So they accepted my request and they agreed to it. Only because I was able to give in that 30 minutes. After that, I didn't have any issue with breastfeeding. All this tandem feeding and biting and all that I had, but then the milk supply I didn't have any issue because, and also in South they give food that produces milk. And
Yes.
also when you have C-section, you will not be able to sit and feed the baby.
Yes,
So
yes.
pillow and you can lie down and feed. So ways of feeding is there. C-section also you can immediately feed.
Yes. Yes, right education is important. That's where if you are not getting a help from the hospital, you can always get a help from lactation professional. Okay. So there was one Ayurveda doctor who did the course with us. She is actually Ayurveda doctor and lactation professional. So if some of my clients have issues, I always suggest I give them her contact, and she is able to give online consultation also. And there was this Dynek who did the course. She and her husband is pediatrician. So they both are also running this campaign of breastfeeding, because she had mentioned in the course that I do not let any woman go without breastfeeding. That is her aim. She doesn't know, even if there are some issues, there are only few reasons why a mother would not be able to breastfeed. Is one is C-section. Okay, if C-section, it was planned C-section, in that case the oxytocin levels could be low. That's why the milk letting the milk out will not be there. So expressing will help in that case, or sucking the nipple will help your own body to understand. So some ways or the other there are there. If a woman has a thyroid condition, in case of thyroid, then a breast milk will not be produced. So you continue with your thyroid medication, then breast milk will come. Sometimes it could be nutrition deficiency. If there are no proper nutrition, in that case also breastfeeding will not come. So nutrition deficiency can be treated with the right supplements and some Ayurveda supplements. Okay, so these are only the three major causes of when women may not be able to breastfeed. So you address, she said, I address the issue and they would have the breastfeeding coming. Yes, Preeti.
I just want to add, I just want to share something. Not all now people are becoming aware of breastfeeding, but then not all pediatricians are okay with breastfeeding. They will say at 4 months you stop, enough of breastfeeding. You can start solids for the baby and everything. And in my case, the first pediatrician I was seeing, my son got jaundice in 7 days. So the doctor said 7th day he got jaundice. And the doctor said, you admit him in the hospital. We will keep him in, UV light. And then my friend is a lactation counselor. So I asked her, she gave me another doctor who is okay with breastfeeding. And he said, you don't have to breastfeed the baby. You stop breastfeeding. In 7th day, he told me, stop breastfeeding. You put him in the hospital, admit him in the hospital. I went to another doctor and the doctor said, you just continue breastfeeding. The jaundice will go. But it will take time. You don't have to admit the kid. It will take time. It is not a one-day thing. Today you breastfeed, tomorrow it will go. No, it will take time, but then it will go. So every checkup I go, I'll ask the doctor, when will the jaundice go? When will the jaundice go? He'll be like, you have patience, you breastfeed. Keep feeding. Your breastfeeding is very important. Keep feeding. And it took 1 month to go, but then it went off.
Yes, and you have to expose the baby to the early sunlight. So 15 to 20 minutes sunlight you expose and continue to breastfeed. The jaundice effect will be light if you are breastfeeding, and nothing is going to happen. It is, you don't have to worry about it. Yeah. Any questions? So regarding the food, if you want to ask, you can ask nutritionist tomorrow. Okay, she would be able to help anything in particular. Or if you want to, even after the class, if you want a personal consultation, you can ask her number. You can directly speak to her, whatever works for you. And if you all need lactation professional number, I will share in the group of Dr. Ruchi Agarwal. If you need a help, you can also ask her help. Yeah. If you have questions, you can ask. Otherwise, we'll end the session here.
Ma'am, I have that prenatal one question.
Yes, tell me, Shu.
So, ma'am, in the first trimester physiology, in the manual, it is written if the woman has had any bleeding or previous miscarriages, then extra care should be taken and only gentle poses should be practiced. So here, the bleeding they are talking about is with the current pregnancy bleeding or the previous pregnancy bleeding?
Current.
Okay, because they have written have had any bleeding or previous miscarriages.
Have had, like, suppose they had bleeding in the second month, but they are coming to you in the third month. Okay, or they are inquiring you in the fourth month. So we will avoid asana practice up to 16 weeks and then we will start. Till that time, you may do Sukshma Vyayam, just gentle movements, breathing, relaxation, mantra, meditation that you can do.
Right. So in any case, like if they are spotting or bleeding, like right now, and they have approached you right now, no asana practice should be given, right?
And if they had miscarriage also in the past, then you will also avoid 16 weeks. We will not do because they have high risk of miscarriages.
And that includes, ma'am, Marjorie Asana also. Marjorie Asana also cannot be given if they
It just depends on case to case. Okay. So if she is feeling completely okay, she has good energy levels, then from fourth month, you may do Parvatasana, spinal twist, like seated, all 5 spinal movement, joint movements, or Marjorie Asana you can do, and go with breathing practices. No problem.
Okay, ma'am.
Okay. So always in such cases, such complications, it is very important you check with her that if what her doctor has suggested. Okay.
Yeah.
So you can ask her to sit on a chair and also do simple spinal movements because she might not be advised to sit down on the floor. I think she has gone.
Is there any specific milk formula, breast milk formula to increase the milk supply? Proven one.
You do Brahmari Pranayam, I can tell you in the yogic practices. Okay. Otherwise, in Ayurveda, there are many Shatavari and some herbs are there, they help. For my sister, Shatavari was started from the 8th month. So there are some herbs that can help increase the milk production. In Ayurveda, there are some, but in yoga practice, Brahmari is one of the best practices that can help stimulate your pituitary gland that is responsible for production of prolactin and oxytocin. And you need to eat nutritious, rich food where there is no nutrition deficiency that will also help producing breast milk. Okay, you can actually do the Brahmari Pranayam while breastfeeding also. The quality and the quantity of breast milk will increase. And baby will also enjoy that humming sound when you're doing breastfeeding. You can chant Om or Brahmari while breastfeeding. So we'll end the session here. All of you can sit in any comfortable posture. Relax your shoulders. Hands in Namaste. We chant one Om, Three Shanti together. Take a deep inhale. Shanti, Shanti, Shanti. Namaste. Thank you. Okay, I'll see you all tomorrow. Good evening. Bye.